We're going to stay with that story because in a striking revelation from the 2023 Mental State of the World report, South Africa actually ranks among the countries facing the highest levels of mental distress. And in response, the KwaZulu-Natal Mental Health Advocacy Group is gearing it up for its 9th annual Mental Health Walk, uniting over 25 organizations in order to raise awareness about crucial psychosocial services in the region. And coinciding with World Mental Health Day on October the 10th, this year's event emphasizes the vital theme, prioritizing mental health in the workplace. And for this discussion, let's now welcome Dr. Colinda Linde from the South African Depression and Anxiety Group, and she is the board chair. And of course, Doctor, thank you so much for being with us today. Very good afternoon. Now, as we observe and highlight issues of awareness on World Mental Health Day in just a couple of days, I think it's tomorrow, just how concerning is the report that South Africa actually ranks among countries with the highest levels of mental distress?
Yeah. We're certainly seeing that at SADAG. The call center used to get 600 calls a day before COVID. After lockdown, it became 1,200. And now we're looking at 2,400, and that's been the last 2 years. So even though COVID is not what it was, and you would have thought we're all returning back to normality, we're still having 2,400 calls a day. And it's from younger people, and fortunately men are actually calling in more. But, you've got to ask yourself, why is this number still so high?
Mm-hmm. Very interesting. We're going to get to the main part a little later on in the interview. Thank you for pointing that out, Doctor. But I want us to tackle this first. I mean, why are we so depressed as a country? What are some of the biggest contributors, you think, to our depression and overall mental unwellness? I know that, of course, the report also touched on issues of adult mental well-being after abuse as well as assault in childhood. Of course, giving credence then to the term that hurt people actually hurt others.
Yeah. Look, I think we all know, without becoming too negative, that there is a lot of violence, a lot of neglect, a lot of child-headed households, a lot of single parents. So I think that's one big factor. Another one, if you think about social security in other countries around the world, I don't know that we have those kind of resources. So I think the demands resource situation is a big issue here. So if you think about the demand, 1 in 3 at the moment is having a mental health crisis. So if we're about 80 million people here in South Africa, that's 20 million people. Now, if you look at the resources, so only 5% of the health budget is spent on mental health. So that's only 5% for 20 million people. And if you look at the numbers of psychiatrists and psychologists, you've got more or less 1 psychiatrist per 100,000 people and 3 psychologists per 100,000 people, and then a handful of registered counsellors and things. So I think one of the problems is that we don't really have anything in the middle. We've got psychologists, psychiatrists this end, and then we're starting to get registered counsellors, but the Health Professions Council doesn't really recognise too many other categories. So we just don't have lay counselling as much as we need to. And of course, there are people waiting for community service posts. There are psychiatrists who are qualified, doctors who are qualified, psychologists who are qualified, but they're waiting for their community service posts, sometimes up to 3 years, or people wanting to do psychiatry and they're waiting sometimes up to 3 years to get posts. So if I look at it like this, I think there's a systemic problem going on. And so we're having to just take mental health into our own hands and mental wellness into our own hands, because we're certainly not getting resources elsewhere.
Absolutely, Doctor. And I'm sure you saw the interview preceding this one. Of course, they were talking about the fact that the resources in this country generally pertaining to mental health are actually at not great levels. And you were talking about those community service posts. They could really go a long way in assisting, because we still know that there's still a lot of stigma and misdiagnosis, especially in places that don't have the necessary information about mental mental issues, leading to either unidentified mental disorders among our peers, or in worst cases, no treatment at all. And the results of this is actually quite worrying. So what are organizations like yourself, SADC, doing to ensure that mental illness gets the necessary attention it deserves across all health as well as social platforms?
Okay, so SADC has been going for 30 years this year, and it's an advocacy group. So it fights for patients' rights. We engage medical aids, we engage government, and SADC also, across the whole country, has many support groups. They're all free. And the website, sadc.org, you can go on there, you can see videos, you can connect with other people. We do Facebook Fridays, we do huge outreach. And this last few months, we've been doing a lot more work in schools to actually start educating children, even in primary school, so that we're starting there. And so we're educating teachers, children, whoever we can, and programs like this, where we're talking about mental health, that, 20 million of us in this country, 1 in 3, is suffering from a problem in the mental health space. So the more information that is available out there, the better. Mm-hmm. And this is where I really feel, we all have internet connections these days. So if anybody's not sure if they or somebody they care about is going through a depression, it's not just a blue day, it's not just normal anxiety, please go to sadc.org and you will find resources there. You can contact the call center. You'll have a real human speaking to you. You can join a support group. So there is support. We just have to try and really do it ourselves. In South Africa, we do everything ourselves, security and electricity and water wherever we can. So we'll do mental health as well, since we don't have the resources coming from elsewhere.
Absolutely, Doctor. Unfortunately, we're out of time. I was going to go into that aspect that this report actually mentioned that men in South Africa are actually registering the biggest sufferers of mental distress. And of course, I was going to ask you about some of our individual responsibilities and some of those things, easy signs that we could spot amongst our peers as parents, as guardians, as peers, in terms of those that could potentially be suffering from mental illness. But we're going to leave it there. That was Dr. Colinda Linde, the SADC Boche, as we observe World Mental Health Day tomorrow.